and welcome to the Spawdcast. My name is Carrie Hyde, and I'm your host and your pet's life coach. Today, I'm going to be speaking with Dr. Michael Dim, who you've met on my show before. I also work with Dr. Michael Dim with Joey's Legacy when we do roundtables talking about veterinary malpractice, which is how I met Dr. Michael Dim. But I would like to introduce him to you. So welcome to the show, Dr. Michael Dim. How are you?
Great to be here, Carrie.
I love talking to you. It's just the connection that we have and understanding about, we've both been in the industry for a really, really long time. So a lot of times, yeah. So when I'm talking to you, we're both like, yeah. Oh yeah.
Yeah, exactly. Yeah.
So sure. I reach out to all of my guests and we kind of have a little chat right before about things that we want to talk about. So of course I reached out to Dr. Dim and we had a little conversation and we agreed to talk about immune-mediated disease. And so that's what we're going to be talking about today. Dr. Dim, can you define what that is for us first before we get into this?
Just immune-mediated disease, simply put, is where the animal's immune system is overreacting to either external environmental factors, whether it be things in the air, environmental allergens, molds, dander, ragweed, pollen, trees, grasses, what I call doggy hay fever, or sometimes ingested allergens in the foods or things they're getting or ingredients they're getting into. And it includes that group, but it also, or to fleas perhaps, but it also includes the body's own immune system attacking the body's own self. So that would mean the various, endocrine systems, the pancreas, the adrenal glands, the thyroid, the brain, and immune-mediated diseases of those organs lead to common illnesses that we see in everyday practice, such as diabetes, thyroid issues, Cushing's disease or Addison's disease, an underactive adrenal gland, obviously neurologic disorders like seizures. So these are all things that come into play when we have, the immune system overreacting to either itself or external allergens. Even diseases like heart disease can be an immune inflammation of the heart valves that leads to leaky heart valves and subsequent heart murmurs and congestive heart failure. So certainly, when we look at immune-mediated disease, it's a whole gamut of various conditions that involve multiple organ systems.
Is it, sometimes people say autoimmune disease. Is this the same?
Right.
Or?
Well, autoimmune would be like those group that I mentioned where the immune system's attacking the body's own cells. Like for the skin, we see various diseases called pemphigus. That's where the immune system attacks the skin layers. That's an autoimmune issue. Immune-mediated disease, like diseases of the bowel, inflammatory bowel disease, where there's inflammation in the lining of the bowels, or what I call doggy or kitty Crohn's disease. Those are more, those can be autoimmune related also because the body's attacking the lining of the intestines. But more the external agents like the allergens, the inhaled allergens, the contact allergens, the food hypersensitivities, the fleas, those can also be considered immune-mediated illnesses, but they're not to the body reacting against its own self, which is the definition of autoimmune disease, but more reacting to outside agents, external agents. Yeah.
So
they're both immune, under the umbrella of immune-enhanced illness. One is auto, meaning against self, and the other is more immune governed, which doesn't have to be against the self.
That's a great definition because people would never really consider fleas to be an immune-mediated disease, right? Like, why would someone ever think about that? But if you do take something as common as fleas, which we're probably never going to rid our whole earth of fleas, so they're always going to be around. Right. But should our animals be able to get a flea or two on them and not have this horrible reaction. That's kind of what you're talking about when the immune system can
Yeah,
react?
exactly. Yeah. When you see multi-animal households where you'll see, some animals loaded with fleas all over their body, not itching at all, and then you'll have one animal that'll have one or two fleas, and they go into a whole itch tizzy, and they, one, and just reacting to one. So that would be they're sensitive to the flea saliva. There's an immune sensitivity there. In fact, when the dermatologists do the old ways, the intradermal skin testing, where they inject various allergens into the skin and they're looking for reaction, flea saliva or flea allergen is one of the antigens they sometimes inject into the skin, and not every animal reacts. That's why animals can be walking around with fleas on them and not itch. Right.
Wow. Okay. Now I'm going to be a little nervous here because my own dog has flea allergy, dermatitis, or however if one
Right.
flea on him and he will react. He will react. I don't
Right.
use any kind of flea or tick anything, and every once in a while he'll pick up one. I know immediately when he has one on him because he
Right.
becomes
Right.
reactive. So now I'm thinking, oh, great. Is that something I have been kind of just accepting as he's just allergic to the, but you're saying that there might be maybe an imbalance or something. Is it genetic? Is it?
Yeah, it's probably genetic, or if we look at it deeper homeopathically, an energetic mistunement of the patient to react to the energy of the flea bite, because every, material substance has an energy to it. For example, when I'm in the same room as an animal afflicted with fleas, I'll start itching on my ankles, even though the animal may be across the room, and I'll even see like little flea bites on there. That's interesting because we in homeopathy understand that disease is transmitted energetically rather than through material substances, and then we manifest physical symptoms through our, through whether it's itching or other changes in the body. So looking at it from both perspectives, it is it can be considered genetic, it can be considered energetic in origin. No
Wow.
matter which branch of holistic medicine you look at it.
I should mention to our listeners, Dr. Dim is a holistic homeopathic veterinarian. So,
Right.
which I've said on this show, I don't know if I've said it while talking with you, but you can have, the way I look at it is you can have a holistic veterinarian who's not a homeopathic, but to have a homeopathic veterinarian that's not holistic
Right.
wouldn't make any sense. So I encourage
No, not at
people,
all.
and we've been talking a lot about homeopathy on this, and so on this program, which is really interesting to me. It's something I'm learning about. So I'll have to spend some time with Ansel. That's my dog's name that has the, and you're right. Nevada, my other dog, can have a flea on her and there is zero response from her at all.
Right.
I
Right.
just,
Right.
so that's super interesting. And then you talked about allergens. So pollen, those kind of things would also be an immune mediated
Sure.
response to
Right,
that.
because not every animal that's, let's say, having that intradermal skin testing is going to react to pollens or molds or grasses or trees, and that's the old way the dermatologists used to find out what it is the animals were reacting to in conventional medicine, and then formulate vaccines to try and desensitize the animal to the various things that they were testing positive. They would inject, it's called, they inject it right into the skin, and then they look for a response of the body to the allergen. And then if there's a positive response, they would consider, depending upon where the animal lived and what allergens are in the environment, putting those components into an allergy vaccine to try and desensitize the patient to the allergen. So that's kind of how it works. Yeah.
Wow. So if you have one of these dogs that's having, is there a way to determine whether it's DNA or it's a genetic component or it's a more of an imbalance in the immune system? Is there testing for that?
I don't think there's really much genetic testing that's gone on yet. I mean, I don't think we've really explored, a plethora of genetic mechanisms of why these things occur. But what I will say is that genetics is certainly the basis of a lot of things. Again, in energy medicine, we go deeper than that in terms of causative perspectives of why we have certain symptoms. But each of these various conditions, whether it's the endocrine or hormonal autoimmune conditions, the skin autoimmune conditions, they obviously do have a genetic basis. And a lot of times what happens is things we're putting into the animal, injection wise, vaccines, too many pesticides, poor diet, flea and tick medication, those can act as triggers to cause the immune system to then react. And then some of these genetic conditions then manifest themselves.
So would you think that genetically, right, that was one of the things I was going to start talking to you about, is obviously what's breaking down our pet's immune system, which we've talked about on the show many times, although it's interesting to think if you have an animal who's allergic to fleas, and I hear this all the time where people, well, he's allergic to fleas, so I have to give him the flea and tick stuff, otherwise he bites himself raw.
Right.
But we're just kind of causing this snowball effect where it's getting worse and worse.
Sure.
And worse. And it's interesting to note too, I don't use any of that stuff on my dog, but I've read all of the inserts and they say may cause itching on every one of them.
Right.
So that's
Right.
interesting in and of itself, that you might be able to
Sure.
stop doing that and it's in there. But do you think that the immune system gets destroyed to the mothers and then that immune system is then passed down? Is that something that you're...
Sure. Yeah, sure. We see, animals, let's say, that are prone to what we call atopic skin disease, that have chronic ear problems, hot spots, chewing of the feet, that kind of thing. And then their puppies and their offspring will have a similar kind of situation. We just don't have the genetics necessarily worked out with a lot of these things. I mean, the genetic studies of certain severe diseases like DM in the German Shepherd or degenerative myelopathy, I mean, they're looking at genetic aspects to various conditions so that they can maybe, not breed some of these things on. But very often the components we put into our animals, like over-vaccination, like the pesticides and the flea and tick medications, cause genetic mutations. And actually that then will lead to new diseases that we never saw before. So a lot of times when we overdo some of the chemicals and the drugs, for example, you brought up the flea aspect. We put these, if you put on, the chemical flea preventatives on the animal, sure, you'll kill all the fleas and the larvae and all that. But like one of my colleagues, Dr. Blake, once said, it's like burning down a house to kill the ants.
Yep.
And, it's kind of like, you're really not getting at the vibrational mistunement of the patient, or the fact that the patient's vibration or frequency isn't high enough that they're attracting fleas. And so we want to work on their health holistically, both from a functional medicine perspective, with good diet and good gut health and all of that, as well as from an energetic medicine perspective with homeopathy.
Yeah, that's one thing that I, every once in a while, like I said, Ansel in Nevada, I'll get a flea on them. But, I take them on a lot of hikes. I can't expect nothing, I don't think. Although I am surprised that they don't get more. Like I have dogs that come in that are just infested in fleas. And I always think that has a lot to do with, obviously, my dogs are on a species appropriate diet. So I know that plays a role.
Right.
But one of the reasons I didn't want to spend... I wanted to make sure we talked a lot about that because it's interesting to think of that as an immune response, whereas I've never considered a flea allergy an immune response. I don't know why I didn't think of it in terms of that. So I'm hoping our listeners will start to look towards that to see if allergens can be handled if you build the immune system up instead of,
or balance the immune system. Sure.
Yeah. Mm-hmm. Instead of using products that, or pills that is stopping the immune system. So but let's talk a little bit more about the autoimmune mediated diseases. Those, just from what I'm seeing, have skyrocketed. Have you noticed? I know you've been around.
Yeah, no, absolutely. I mean, I do some part-time work, 1 or 2 days a week. I help out a colleague who has mostly a conventional practice. And I see all these dogs coming in that are getting the Cytopoint injections and the Apoquels and all the skin overreactive immune response. And then these are the same animals that I'm seeing that come along later, and they start developing chronic wheezing and coughing. And so from a holistic perspective, what's happened is that immune-mediated disease has gone from an overreactivity to allergens and pollens and trees and grasses and outside agents, like fleas or foods. And it's now gone internally, where the body is now forming an immune response around the airways. And then we later see that as what we call COPD, or chronic obstructive pulmonary disease, or allergic airway disease. And what drugs are used to treat that? The same class of drugs we use to treat the ones on the outside, except it's a more serious condition because it's involving the ability of the animal to breathe, So
What about
it's
what about collapsing trachea? That I don't think, I honestly don't think I ever heard of that back when I was a vet tech many years ago. Now
right,
it's all these dogs. You think that has
right.
anything to do with
Well, I
this?
think there's a component of that. I mean, the way I learned it, maybe I'm not, I don't stay too current on this aspect, but the way I learned it was that it was, the cartilage weakens in the trachea, and then that leads to narrow windpipes or narrow tracheas that then lead to this goose honk type coughing. But something has to start the process, just like something starts the process in your German Shepherd, who all of a sudden starts dragging its lower legs and now has a neuroimmune condition of its lower legs. There's, the diagnosis is usually, well, it's genetic, or it's, the cartilage is just degenerating. They don't look deeper, but what's causing that is some sort of, like I said, either inflammatory or immune response causing the cartilage to get weaker and then to narrow, or perhaps from a homeopathic perspective, we look at it from an energetic causation. So I feel a lot of these illnesses that people assume are just, well, that's genetic, or that's just, common in a little Yorkie or a little Pomeranian or a Maltese, that a lot of these conditions are actually immune, mediated conditions as a result of, again, the same cast of listed of agents, characters that we see, such as, the vaccines, the pesticides, the poor diets, the environmental and airborne allergens, all contributing to a distortion of the immune function. And then leading to these conditions that, while we have drugs to palliate or band-aid or suppress the symptoms, don't really get at the cause of it, which, if you go back, it's all these things we're putting into the animals.
I'm hearing a lot more veterinarians saying that they're just born that way. You can change their diet. You
I
could
know.
do. I didn't used to hear that as much. They would just say, "Oh, he's got, whatever it is, an autoimmune disease, and we're going to have to treat him this way." But now it's like they're fighting back against nutrition and fighting back against holistic medication. And so now, if diet hasn't worked, because people think diet can solve every single problem there is.
Yeah, they often do.
Yeah, and then when it doesn't, because it's only one part of the whole
picture, yeah.
Right. And so they'll try one part of it and then it doesn't work. And then it reinforces the conventional veterinarian to say, I told you, your dog was born this way and there's nothing you can do except Band-Aid it. And that's I'm hearing that a lot, and it's heartbreaking to hear that.
Yeah. And even once those cases get to that level of pathology, like the collapsing tracheas and the bronchitises and, those kind of dogs that we see, that have chronic coughs, we're usually limited to the same type of drugs, a cough suppressant, a steroid, a bronchodilator, and they're just only partially effective. And then sometimes those animals then go on and develop what's called pulmonary fibrosis, which is scarring of the lungs, and the scarring of the lungs is irreversible. And that's something that often the animals then have to be put to sleep. So none of these drugs really get at the cause. They assume that it's genetic or it's this or it's that. But as I said, I see a lot of these Cytopoint, Apoquel treated animals that, and to be fair, Carrie, I have to look at also, look, you and I mean, I'm working with a case right now that you sent me, and I like to be upfront and honest with the audience too.
Yeah.
We don't solve everything with homeopathy or with holistic therapies. I mean, you worked hard on this particular case. We won't
Yeah.
mention the name. Worked with Dr. Dodds for an immune component of its digestive issues, if I remember the history. And we come in later on with our therapies where what you and I do is best applied when they're puppies and kittens. So that way the immune system isn't destroyed. A lot of these animals that come from shelters or breeders or rescue organizations, even though their hearts are in the right place, they really don't want to hurt the animals. It's just a model of medicine. And they end up, intoxicating these animals with all the flea and tick medicines, too many vaccines, too many wormings, which causes leaky gut and all the other, cascade of events. So by the time they get to you and me years later, there's a lot of long-term pathology there. And sometimes to allow the body to heal itself, the level of discomfort that the animal has to go through to detoxify or to, build up healthy flora from a functional medicine perspective, it takes too long sometimes, or the clients can't stand to see their animals in cones and chewing their feet till they're falling off. And, that's not a fault of yours or myself. It's just, unfortunately, when they present to us after years and years of this kind of, training, sometimes we'll get, obviously we do get miracles and success stories. Otherwise we wouldn't do it. But the frustrating ones are these ones that are, we're doing all the right things and we're giving remedies, or we're doing functional medicine with the diet and the gut, and we're eliminating some of these outside toxic factors, and they're still itching and miserable and in cones. And sometimes those animals end back up on medications and drug therapies. And I understand why, because they're suffering.
Yeah.
And I understand that. It's not like we all didn't put the old effort in. And, so in this one particular case, I gave one remedy and the dog got worse over the few weeks. And now I've tried a second remedy and the owner's ready. She just started working with me, the guardian. And, and I was honest with her and I said, look, we're doing the best we can. I certainly would understand if you felt the need to return to, the system of medicine that got us into this place, because your animal's quality of life just isn't what it should be. And I try to be a practical clinician. In other words, if I don't make a very good patient myself, Carrie, I like to share that with my clients because it allows them to see that, and I've had, challenges in my life, which obviously are personal, that I've, had some suffering. And when I say suffering, I meant, discomfort. And I don't handle it very well that's my constitution. So I can relate to my clients who don't want to see their little babies miserable or going through all these prolonged aggravations and symptoms. And so I really understand that. And I think they really appreciate when I bring that up during my discussion with them, is I really get it at, in my heart level, because I myself don't handle discomfort very well. And so these are your children, these are your little babies. And I get it where it's like you try to remedy or two and it's like, that's like barely anything. I mean, usually we'll tell clients, you got to give a process at least 6 months before you can make an assessment whether you're succeeding or whether you have to try something different. Yeah. And sometimes they have to become integrative cases, where we can't be purists. And sometimes they end up going back to traditional medication, traditional medical treatments, in order to relieve the suffering. And so, as I said, in my own health challenges, I've certainly had, times in my life where I've experienced that. And I understand that. It's not that I want to be putting anything into my body that's not good for it, but sometimes we have to realize that if the suffering or the discomfort is too great for the individual patient or the mommy or the daddy, that we might not have a choice but to go integrative or to take the edge off, even though we don't really want to, because that's what got us into the trouble in the first place.
Well, that's why, that's actually why I really like talking to you. And I'm careful when I'm reaching out more to homeopaths and even holistic veterinarians. I want to be very careful in bringing somebody in who is a total purist, who absolutely will not allow for anything except homeopathy and, a holistic kind of approach, because I believe that your pet can't heal, you can't heal, no one in the family can heal if we're stressed. And if you're
Right.
stressed and your animal's over there in pain and you're stressed, then the animal's stressed, then the homeopathy is not going to work anyway, because you have to get to a place where you're comfortable with it. And if too much time goes by, then the stress increases. So it just
Right.
kind of all has to work together. You have to be comfortable with it. People come to me a lot of times they hear about it and they think that a species appropriate diet is by far the
Going to
best
be
thing.
the end all of end alls, right?
Yeah, and they're like,
Yeah.
let's just do it. I want to do a species appropriate diet, but I'm nervous because my vet is against raw. He thinks my children are going to get sick. I just had a case like this the other day. My vet thinks my children are going to get sick. And I said, listen, then how about we do a cooked one? So that takes the
Right. Right.
stress off of her family. There's just too much going on.
Sure.
Of course
Right.
I
Right.
like a species appropriate diet, but I'm not going to put somebody on it that is nervous about it, because it doesn't get
Right.
us
Right.
anywhere. And I think
Yeah.
that in and of itself can cause disease. Stress is such a big deal. And
Right. And our animals are obviously what an ex-girlfriend of mine used to call psychic sponges. They take
sure,
on our stuff. A lot of
yeah,
times they mimic our diseases, our illnesses, our physical appearances,
yep,
obviously,
yeah,
sometimes, energetically speaking. And so, if we're dealing with a high stress environment, I had a client once where I was trying to help in a purist way with homeopathy, and we palliated the symptoms until it could, you know, go as far as it could. But in this particular environment, it was an older dog that had this big mass right by its rectum that was putting pressure on the ability of this dog to move its bowels. It was like a
oh,
colonic or a rectal mass. But the interesting thing was the dog lived with an autistic teenager who was in and out of the hospital for various things, and whose major clinical complaint was intractable constipation,
wow,
and had a hard time. So here, this animal, man, because of it, and in the house it was a Latin family, big family, where everybody, all the relatives lived together, and all of that, a cultural thing.
wow,
And this animal was most attached to the autistic young woman, and it was manifesting a pathology that was reflective of the young woman's challenges. So
yeah,
we have to realize that there's this dynamic relationship. Samuel Hahnemann, I don't know if Dr. Pitcairn spoke about, he probably didn't, but he
yeah,
talks about this in our classes when we go to our meetings. He'll talk about how there's the life force of the animal, and then there's the life force of the family, that pervades the house. That you have to see there's an interconnection there of the energies, and
yeah,
then there's the energy of the community, and then the energy of the world.
wow, oh
Our
yeah, yeah,
government and our world. And so that's why when we look at what's going on in our society today, and all of the sad fear-based toxicity that's going on, and those of us that are sensitive to that, it's a challenge for us because we're really walking on the fringes of medicine, and we're often bastardized by our colleagues. You can't even turn on the news without, not that I watch the news very much these days, but you can't even turn on the news without seeing all this fear-based, pressurized medicine with COVID and all the vaccines they're pushing, and younger children. And it's hard not to be affected by that, when you're a sensitive being that actually knows what the right approach should be, and it's not that. So it puts a lot of emotional strain on us as veterinarians, and a topic for another show. But I'm sure maybe this would be a good one if you haven't already had it in one of your seasons. But the incidence of especially even amongst holistic vets, but in veterinary medicine in general, of mental emotional disease and suicide and all of that is really difficult, because it's to have to practice within like a small island. That's why we have to all stick together.
yeah,
An island of just fear-based establishment medicine is not an easy challenge for us that are sensitive souls that came here to, be courageous and bring other models of medicine into play. And so I bring all these things up because the interconnectedness of all of us, and especially that case with the autistic young woman, literally always being in the hospital for fecal impactions, and then the dog developed a mass right at the level where she was having the fecal impactions.
Wow.
And I never, it was a very interesting case. We kept it as comfortable as we could for as long as we could. But I wasn't going to cure that with homeopathy, treating that animal, because this autistic young woman was very difficult to live around and was, obviously, understandably so, and was in and out of hospitals. So we can't just look at that animal in a bubble.
Yeah.
And so that animal, I don't think I gave drugs to it, but I was just only able to make so much progress in that case because of these surrounding obstacles, whether it's the, like you said, the guardian's stress level. In this case, it was the autistic young woman's stress level, whether it's the guardian's willingness to be able to do a raw diet. You probably get this all the time. Oh, I tried all that, not all the time, but occasionally. I tried the raw diet. It didn't work. People think it's like the cure-all of cure-all. I mean, Dr. Pitcairn's first book, his first edition, written back in the late 70s, early 80s, I remember in the beginning of the book, and he brought this up when I took the course, the professional course back in the late 90s, he brought up that, he brought up that, a Cocker Spaniel came in to see him, and it was chronic ear issues and skin disease and all these other things. And this was back probably in the 60s when Richard first started practicing. And he said, you know what, we're just going to send you home. And nobody back then was recommending a raw diet. And I think it's a story in that first edition. I don't know if he carried it on in the later editions, but we're going to just put your animal on a raw diet and bring you back in 6 weeks and see what happened. Well, they made a recheck appointment. They never showed up. So I think Richard's wife, Susan, called and said, where's the, looking for, what happened to the patient? He's all cured, Dr. Pitcairn, right? The skin disease is gone. The ear problem's gone. Now, there's two messages there. One is back in the 60s when animals weren't generationally over-medicated and vaccinated and over-intoxified like they have been over the past 30, 40 years, those animals were healthier than the ones that were born today. So back then, and in the 70s and 80s, it was a lot easier to solve a lot of these issues with just the basics of a raw diet. But because of the level of environmental and medical toxicities that we're putting into our patients and that we're exposed to, it's a lot more difficult to solve that itchy Cocker Spaniel with chronic ear problems and skin disease with just a raw diet. And we have to keep that in mind.
Yeah. No, I bring that up constantly when I'm talking about diet with people, and we talk about wolves and what wolves eat and what they do. Of course, we talk about. You probably know, our listeners know, I am not a believer that a canine is a complete carnivore and should only eat meat. But I also know that a wolf doesn't have flea and tick stuff put on him. He doesn't have vaccines. He doesn't have metronidazole given to him every other week, it seems like, for diarrhea and dewormers and all that stuff. So the diet does play a great role for a wolf, what they eat. But yeah, people don't realize that. And they just think if someone says, well, feed them like a wolf and they'll be healthy, then they go feed them like a wolf and then they're not. And then, it does actually happen all the time. People will come back in and say, you said, and I'm like, no. I said that's one component. And
exactly.
You had brought it up earlier in the show that the puppies are really where this starts. So we have such a
actually earlier. It actually starts.
Yeah, you're right. Mothers, the mothers and the grandmothers.
You probably know this, Carrie, maybe you don't, but vaccinosis, which is the homeopathic definition of mental, emotional, physical symptoms from the act of being vaccinated, I read 20 years ago, is now an energetic phenomenon that's passed on epigenetically. Wow. In other words, young puppies and kittens that haven't even been vaccinated are born with energetic vaccinosis because of the parents and the grandparents and and generations past. So,
Yeah.
you know.
No, I don't doubt it. And one of the reasons I don't doubt this, I remember asking Dr. Margot this, Dr. Roman, she had been originally when she had to go to an orientation for when she was going into veterinary medicine, and they wanted her to run a titer on herself that she had to do
Right.
for fleas. And she started thinking about, why aren't we doing this for the pets? And then that led her down this road that she's on today, where she started looking at the effects of these vaccines and how long that they would stay in the dog's body. And then I asked her,
Right.
when I was a vet tech, when I first left, I started noticing that dogs and cats would get sick right around 2 years. I would always say, oh, I can look at your record, and at 2 years, your dog's going to be sick. But now I
Right.
see
Right.
these autoimmune diseases and these, allergic to fleas, all of this stuff. It's 6 months old, 4 months old.
Right.
They're
It's younger and younger. Yeah.
younger and younger and younger until they're going to be coming out of the womb and their eyes aren't even going to be open and they're going to be licking at themselves,
They'll be
And
looking at themselves. Yeah.
yeah, from the moment they come out of the womb, they're practically having these problems, and it was really hard for me to realize that. And it was only a couple years ago I realized, God, these puppies are so sick from the get-go.
Right.
And
Well, it's I when I used to give lectures, I would say, I was a kid and when I grew up in the 70s, and one kid in a school of 500 was asthmatic. And I remember his name. He was a friend of mine. He was the only kid in this whole school that would come and had his inhalator and his epinephrine if he had a reaction. And, asthma now is epidemic in children,
yeah,
in younger and younger children. And this was a school of 500 people in elementary school. And so we are seeing this increase in autoimmune or immune-mediated diseases that, we didn't see many moons ago,
yeah,
so.
we need to get it under control and figure it out. I have been recommending that people seek out, if they're going, it's really hard. This is really hard because I work in rescue. Most people know I work in rescue. So it's really
Right.
hard for me to tell people to seek out a natural rearing breeder to get their animals, because it puts you in
Sure.
this predicament, because I really want people to rescue animals, but I also recognize
Right.
that when you rescue an animal, you're more than likely going to be taking on. But that matters if you buy from a breeder too. I have
Right.
purebred, super expensive, paid $5,000 for puppies that are coming in with these autoimmune diseases. So
Right.
you might as well get it from the rescue and then try to help him and spend the money there. Imagine spending $5,000 to try to get a puppy to eat better and see what you can do with
Right.
them. And there's
I
not,
always tell people with that, with the
yeah,
rescues, that's the way to do it. I mean, those animals need homes, they're loving creatures, but I say, just be prepared. You're going to have potentially, months or maybe even years of dealing with
detox.
chronic illness, and
Yeah.
you're not doing anything wrong. So everything we tell you about raw diets and about other alternatives to the pesticides and the flea and tick and heartworm medications are all still relevant. It doesn't mean, oh my God, I tried that holistic lifestyle, it didn't work. It's just that those animals are already intoxicated before you've had a chance to even,
yeah. If not
with them.
if not more. I know I have, it's kind of sad and it's hard for me to do, but I have 3 rescues right now that I bottle fed. I bottle fed them straight from raw unpasteurized goat's milk is what they ate as bottle feeders. And then they went straight on to a raw diet. So they have never had anything but species appropriate. Well, I don't know if you can call goat's milk species
Right.
appropriate for a cat. But
Right.
before they're even 3 months old, they are going to go get dewormed. They are going to go get vaccinated, and then they're going to get spayed and neutered. And I have no control over that. There is nothing
No.
I can do about it. So I tried to
Yeah.
set them up as much as I can for as much success as I can by giving them the healthiest diet I can find. But you can find a puppy on the streets, take him into the vet who is just vaccinated. Maybe the owner lost him and he was just vaccinated, and they will revaccinate him the moment he walks in the door.
Right.
So a lot
Right.
of times those dogs and cats are just bombarded with so much stuff, but so are the very expensive puppies that you're buying. So people
Right,
think,
from the breeder, yeah.
yeah, the breeders are doing it. I see breeders
Yep.
that are just, they're all vaccinated, they're dewormed, and they're feeding, horrible diets because we have these big
Right,
dog food manufacturing companies that, put that
right,
stuff in. So you might as well, if you're going to spend $1,500 on a dog who's going to have medical problems versus
right.
using that to rescue an animal. So, or if you really want to, I say there's a few natural rearing. I know Dr. Roman does some natural rearing
Oh,
puppies.
yes, she
Mhm.
does. Yes,
Yeah.
she does.
So she
I
does.
know Margot for years. Yes.
Yeah. So she has some poodles that she's,
Yeah.
that's kind of a way to go. But I don't know how we stop it. I don't know.
Yeah, I mean, Ron Schultz, who's not a holistic guy by any sense of the means,
Right.
the immunologist that many who listening or watching may be aware of, but Ron Schultz made a whole video, I mean, about shelter medicine. See, because shelter medicine, as you know, Carrie, is a different population than your like somebody bringing a little Yorkie who lives on the 50th floor in New York City. Dr. Dim, keep my Yorkie healthy holistically. Am I going to be recommending leptospirosis vaccine and Lyme
Right.
vaccine and all these other things? Of course not. Even if I was a conventional mainly vet, but when you're dealing with shelter medicine, you are dealing, unfortunately, Carrie, as you know, it's frustrating, with what's called herd health. That's what we hear on the news with COVID, even though it's distorted herd health. It's not even true herd health, but it's even more tragic. But in the shelters, remember, there's so many unwanted animals and animals that are euthanized, and most of our public still is conventionally oriented in how they raise their animals and their families. So believe me, in order to get those animals adopted, you know this, they want to, wow, the shots are taken care of. The spay and neuter is done at like 6 or 8 weeks or 4 months of age. And the front line's been applied, the heartworm test, the feline leukemia test. It's all done. They don't have to pay for it. So you see how that's hurt health. But I brought up Ron Schultz because Ron Schultz has a whole video where when these animals come into the shelter, especially the ones that are 4 months and older, that these titer checks should probably be done on them to see if they need it.
Yes.
And he's talked about that. You can find that. I don't have you could probably Google that, Dr. Schultz
I'll
and
find
shelter
it.
medicine. Yeah,
Yeah.
you'd probably be interested in it, where Ron
I
is
am.
recommending to do titers when these animals come in, that they're rescuing in the Bahamas or in the, the hurricanes or the
Yeah.
Haleys or wherever
Yeah.
they're coming from. And rather than just poking them full of everything, run a blood test and see if there's, natural, exposure or
Yeah.
natural immunity, to use that key word that we're hearing about so much
Yeah.
now.
Yeah.
You know?
I wish they would, and I wish the shelters would understand a lot of, not
Right.
to go off on it too much, but they really could save a lot more money if they would spend more time looking at it. Like my kittens that I have never have upper respiratory infections or any of these diseases because they're not being fed junk food and formulas and stuff. So the money alone they save, but
Well, those upper respiratory diseases, and I've spoken to ophthalmologists, specialists. The only believing, for assuming someone believes in minimal vaccines, the only real effective vaccine for those young cats is panleukopenia in terms of its ability to stimulate some sort of immune response. And
right.
they do see, it's called kitty parvovirus. And the other 2 and 3 upper respiratory viruses that are in that combination shot, the herpes, the calicium, you're injecting that into the body, and it's causing chronic herpes and chronic calicivirus. I mean, just go into any shelter and rescue and see all the snotty cats and all
They're all sick.
because they shouldn't get the vaccine because they already have it. It's like vaccinating for something that you already have in your body. You're not going to get healthier from that.
Yeah.
So, just the way it's done. So that's why Dr. Schultz talks about, even in shelter medicine, running the titers on these new animals that come in, seeing if they're low. I mean, the titer checks aren't an expensive in-house kit that they have. They're not the perfect test, but at least they're something. And at least that might avoid giving these animals so many inoculations they don't need. And again, he's not a holistic guy. He's just one of the leading immunologists and researchers in the history of veterinary medicine.
Yeah.
So
it matters. It matters that these guys are
yeah.
willing to put in the time and do the studies and the research and stuff.
Right.
Going back to some of I know we kind of went off on a tangent, which we like to do. We talked about it before the show. It's okay. We'll go off on a few tangents because they all lead us back to the health of your animal. And so whether you get your pet from a shelter or you get it from a breeder or you get it from a naturopath, you still have a responsibility to keep them as healthy as possible. And learning and educating yourself, which is why I'm here. But one of the things I'm interested in is, and I don't know if you can do this, just kind of off the top of your head. Do you think there's a percentage of dogs that are getting these immune-mediated diseases that are not a genetic component? Like if you had to put a percentage, like 10% is genetics, you couldn't do anything about it. It happened before you even got involved. And 90% of it, I threw those numbers out. And 90% of it is stuff that is preventable without over vaccinating and poor diets. And
well, the best example I can give you, which I used to use in, again, lectures, is there was a study done many years ago, back in the 70s, or 80s, where the dermatologists were looking at dogs given combination distemper, parvo, parainfluenza, all that stuff in a vaccine, that you actually saw augmented or increased, immune responses to pollens and grasses and trees. So the studies are there to show that, giving these things creates or triggers an autoimmune, an aggravated immune response to those environmental allergens. Now, we could probably go one step further, except it's never going to be studied in today's world in conventional medicine. Are those vaccines that we're injecting causing genetic changes or DNA mutations? Pat Jordan talks about this all the time, that actually are the new diseases that we're now seeing that we never saw, 30, 40, years ago. Hyperthyroidism in the cat is a great example. I mean, that disease was first discovered in 1979, and it's a very common hormonal disorder of cats that has many components. Some people feel it's the metal liner in the can. Some people feel it's something in the carpets in people that have animals in carpet environments. Other times it's people that, other times it's from the vaccines, because the thyroid gland is a target of autoantibodies following vaccination. Gene Dodds talks about that all the time.
Yep.
You can't even check a dog's thyroid status with all the autoantibodies if it's been vaccinated for rabies within 45 days, because there's a false positive autoantibody response, and a certain small percentage of those animals will go on and develop hypothyroidism if they're followed. So, I kind of lost my train of thought there, but, that's kind of the perspective we have to take when we're looking at just giving these injections. Are we creating not just the immune conditions, and the studies are there to show it, but are we creating new genetic diseases? So back to the thyroid cats, before 1979, there were plenty of cats wasting. I mean, are you going to say we just never saw those cats? They just were wasting away. They had heart murmur. No, it was a new disease of the modern era. Autism, right, in children is a relatively new disease of the modern times. A movie like Rain Man, made in the 80s, which everybody was laughing at, and was a critically acclaimed movie with Dustin Hoffman and Tom Cruise. A movie like that would never come out nowadays, because the level of autism is so epidemic. So it's like, what are they looking at? They're saying, well, it's genetic, or it's this, it's that. But what's causing the genetic changes? It's the vaccines, it's the poor diets, it's the pesticides, it's the chemtrails, it's all of it. I used to think it was only vaccines, but I grew and evolved, and I now know it's multifactorial, because I have a son who is on the Asperger's scale, most likely, and I think I might have been on the Asperger's scale. I was a shy, introverted kid, and had a lot of social anxiety, and was kind of to myself, and had some sensory issues. But I don't think we labeled it. and I was fully vaccinated with the vaccines at that time. But my son got no vaccines, and he was born. My ex-wife wasn't as health conscious as I'd like her to be, so my kids had a lot of sugar and a lot of processed foods, and I think they're healthier than most kids because they haven't received one vaccine, not either one of my 20 or 23-year-old children. And, I'm proud of that. And I think I probably saved my son from becoming a head-thumping autistic kid that needed probably needed to be institutionalized probably because he does have some Asperger's tendencies. And most likely that comes from diet, other environmental factors, because he's unvaccinated. So to say vaccines, this whole thing about vaccines cause autism and the autistic dog, right? Vaccines are one factor that can be involved with autism, just like we talked about with the raw diet. Vaccines are one factor. Heavy metals, when RFK Jr. was looking at, all the vaccines and the role that, vaccines play in autism, he was only looking at, the mercury and the heavy metals and the aluminum. Definitely don't belong in our bodies and definitely cause problems, mercury and all of that. But not every person who receives a mercury and aluminum vaccine is going to become autistic or going to become, this, that, or the other thing. So it's one model of how to get to that end point of autism. Dr. Wakefield, Andrew Wakefield, had another model where he looked at, MMR vaccine causing what's called enterocolitis in young children, leading to a leaky gut and then getting brain symptoms from the leaky gut. So a lot of his patients he treated with fixing the gut and getting rid of the inflammation there. And then a lot of those kids, autism went away. Not every kid, because not all of them fit that model. You see what I mean?
No, I absolutely do. And the reason I brought it up is because if we talk about, if we say some of it is a genetic component, I didn't want people to think, well, if it's just a genetic component, then I don't want to fight this and I'm just going to do whatever my vet says.
Right.
Because I think that while there is a genetic component, I personally think if the genetic component is there, you certainly don't want to add to it. You're even more responsible to say, you know what, his mom had allergies and his dad had, collapsing trachea. If you know those things, it's a big deal to pay attention to, because you have to be more aware of what you're doing, because I do believe, and you're right, I don't think vaccines are one. I used to think everything was diet when I first started learning about diet. Every dog that would come in would be like, well, he's eating a poor diet. He's eating a poor diet. And he was. Most of them back in my day were all eating kibble. And so I just blamed everything on kibble. Everything was kibble's fault. Right. Of course, I've evolved also. And I'm like, okay, there's way too many components. And some of those components I may never know.
That's why we have to take that holistic perspective. One, I don't know if you've ever discussed this in another podcast or we ever discussed it, but the King Charles Cavalier Spaniel, okay? A guy by the name of Larry Glickman, who used to be a teacher at Penn, an epidemiologist who published some pretty powerful information back in the 80s, or the 90s, I'm sorry, on autoantibodies that occur after vaccines. In other words, antibodies against the body's own tissues, the DNA, the connective tissue, the thyroid. He looked at all that. Well, he looked at King Charles Cavalier Spaniels, the breed, and he found, and that's a breed that gets a lot of heart disease. And obviously, they say what? It's quote unquote genetic. Well, you know what? What Glickman showed was that the King Charles Cavalier Spaniel, they would get vaccinated with polyvalent vaccines, distemper, parvo, and combination shots. That would lead to antibodies against their own heart valves. And so any of the audience who happens to have that breed, stay away from those combination shots, especially as they get older, because that breed, I don't know what the incidence is, but a lot of them have clinical heart disease and are on drugs at very young ages. And a big major factor is the vaccines triggering this, probably genetic change and then an auto antibody response. These are all great topics to talk about, because back in the parvo epidemic in the 70s, it was the Rottweiler and the Doberman Pinscher that were
Yep.
the most affected
Yep.
at the time, and they were
Rottweilers for
over
sure.
right, they were over vaccinated, and parvovirus can cause what's called myocarditis, which is inflammation of the muscle of the heart. So what's the number one disease we see in the Doberman Pinscher, which was rarely seen back in the 40s, 50s, and 60s? Dilated cardiomyopathy, where the
Wow.
muscle starts to not work well. So is that a genetic disease, or did we cause it by giving these vaccines to these animals and created a new genetic disease, is
Yeah.
what I was saying earlier with the thyroid cats. So it's a good way to look at the whole perspective.
Yeah, it's interesting because I remember one of the vet hospitals I worked for was in an area where a lot of Rottweilers live, a lot of Rottweilers and Pit Bulls and Chihuahuas. And
Right.
the veterinarian that I worked for at the time, this is going back to the 80s, and we gave the Rottweilers more parvo vaccines than the other dogs because they were Rottweilers.
Right.
And so that veterinarian was doing them more often because they were Rottweilers throughout their whole life. He would do it every 6 months. And
Right.
just did it because they were Rottweilers. And so, how sad. And I look back on that, of course, I get so angry at myself.
And guess what the first two breeds that I saw in vet school in the late 80s, early 90s that had the quote unquote ACL tear epidemic start? Those were the Rottweilers and the Dobermans, because that disease is not a trauma or an injury like people erroneously think or that are told by the surgeon. It's an autoimmune destruction of the ligaments that make up the structures of the knee or the stifle. And then that's what leads to all of a sudden, boom, they're three-legged lame. It's not like he was chasing after a squirrel and that's why they became lame. It's a chronic immune disease. So an ACL is an immune-mediated disease that occurs,
Wow.
As a result, one factor of being, let's say over-vaccinated or again, another autoimmune component. Who would think that an ACL has an autoimmune or an inflammatory component to it? You would think it was an injury or a trauma.
Yeah, we're taught it's an injury. And while we're on that, what about luxating patella? Never heard of that before.
Same idea, yeah.
Luxating patella? I guarantee you never heard of that. And now I have dogs coming in skipping all over my place, all over, skipping. Because they do it's the luxating patella skip is what we call it, where they're popping their knee back in and then it pops out. And so they kind of skip on it. And I never would have thought of that as an autoimmune response to, that's like, I understand the component of it, the kneecap, and it's not holding all that. But why is it happening more and more? I've been around.
Yeah, right. I remember seeing in the orthopedics rotation at Penn in 1990, I remember seeing the Dobermans and the Rottweilers come in with the ACL tears, but they were also the ones most vaccinated. Now you see the ACL tears in all sized breeds, whether it's a little dog who never leaves the house or whether it. So these are all examples, Carrie, of how we have contributed through our lifestyle and traditional medicine of creating chronic disease and the evidence for it.
Yeah, and partially I blame these diseases. If we go back to vaccines, people are going to be surprised to hear me say this, but boarding facilities. So back in the 80s and early 90s, boarding facilities didn't exist. And therefore, your dog just kind of stayed in his house and you never had to go. Now, all these dogs have to get their Bordetella vaccines every 6 months. They have to get distemper, parvo. They're so much more over vaccinated than they were back in the 80s, because not that people just kept their dogs inside and let them play in the backyard and nobody took them anywhere. And they didn't have to have any vaccines. So it's just sad to think how much of the immune system is being affected. So what can we do? I know as a homeopath, you can't, it's much different. You can't just give out blanket stuff for people, but what other than homeopathy and speaking with a homeopath, you don't want to do this by yourself. You need to have a homeopath help you. But what is there things that people can do to help the immune system, aside from not doing the stuff that we're talking about, the flea and tick, the vaccines, all that stuff? What can we do to help the immune? And diet obviously will help. Is there anything else?
Well, it's being aware of all these factors and maybe making other choices, in terms of the pesticides, the flea, the tick, the skipping of the vaccines other than required by law. Some of the states allow, obviously, medical exemptions for rabies vaccines. A few of them are allowing more now, the measurement of rabies titers. And, like you like to do in your, neck of the woods, is work on the health of the gut from a functional medicine perspective, because much of the immune system starts at that level biochemically, and so that's an area where we can at least, work on, the health and, detoxify the gut and the liver and hopefully balance the immune system from a functional medicine perspective and hopefully see some positive results in addition to educating the clients on all these other issues. Yeah.
So if our clients are listening right now and they have some autoimmune diseases, both, I guess we would call them kind of external, the body's not attacking itself, but it is being attacked. That you can work with people on a consultation basis, right?
Absolutely. I have clients that call me for integrative medicine. I have clients that call me for homeopathy. I have clients that come to me because they just don't want to vaccinate anymore. I have clients that come to me that they want to learn more about a raw diet, even though I'm not a nutritionist. That's not one of my favorite, but I refer to the resources for them to get the right help in that area. And obviously I recommend a species appropriate raw diet. I give some options. About the details of it, I'll refer to some of my colleagues. But in general, though, let me just shut that off. But in general, I try and, I try and really, be there for clients in a holistic manner. And if I can do homeopathy, wonderful. Not every case is a homeopathic case for the different reasons we've discussed here. If it has to be an integrative case, and I've had some clients that come in and the dog's had years and years, and the people's mindset is not really, they have to get it, and so I give them reading materials, resources, and if they really don't understand the concepts, despite my best efforts, sometimes they're best sticking with conventional medicine and maybe just doing a less is more approach. That's how I try and look at it.
I love the less is more. I go with that a lot too. Sometimes I've had people do it. Look, I'm going to do kibble. And then I'll say, okay, then can we add a raw egg into it? Like
right. Try to do something.
Just try to do something is better than nothing. So how can people reach out to you?
Well, my website is drdym.com. That's DOCTORDYM.com. That has all my contact information, my practice philosophy, how my fee structures work. And I prefer to be contacted by email and it's on the website. I don't have a live secretary right now, so I kind of handle all those things myself. So,
wow.
But they just have to go to the website. Yeah.
Okay. And all of those will be in our show notes and everything for our listeners to grab out to. It's important to know that if you're not, you don't have to go in and see Dr. Dim. You can send your records to him and he can do phone calls.
We do phone consults. Yes, absolutely.
Yeah. I want to make sure they know that because sometimes people are like, well, he's not in California. What do I do? So
he's not exactly.
Unless I can get you to move out here and
maybe maybe one day.
That would be super helpful. So, any last words?
Last words are just always ask questions to the audience. Always ask, is this necessary for my animal? Is it needed? Are there other options? Just when you go into your vet's office, find out what is their vaccine protocol. If they say they're holistic, again, there's a lot of false holistic prophets out there that are taking advantage of the interest, but are they selling Royal Canine and Hills and Iams and Eukanuba and Purina in their waiting room? Or are they, at least open to looking at vaccination titers? Are they open to fresh meat diets? All you have to do is just go into your the conventional vet's lobby and just take a bag of food and read the ingredients. You don't need to be a food science major to see that, oh my goodness, that doesn't look like what an omnivore or a carnivore should be eating,
Yeah.
So that's why I try to encourage clients to become informed.
It's a really
Yeah.
good advice is just look around. If you're looking for a holistic veterinarian, they're not going to be selling flea and tick stuff like it's candy, and they're not going to be
Right.
selling poor diets, and then you'll know what you have to deal with. So Dr. Dim,
Right.
thank you so much for sharing all of your years of knowledge and just your expertise
Right.
and your caring nature. Honestly, like you're just amazingly.
Oh, I appreciate that.
The caring goes so much further. You know, some people can be so opinionated that they scare you and you
Right.
don't. So you're easy to talk to, and I think clients probably
Right.
appreciate that about you. I know I do.
Right. Well, I appreciate you having me on. It's always great chatting with you. The hour goes by real fast.
I know. Awesome.
Hopefully people got some good information today.
I hope so too. You have a wonderful, I guess it's
All
later
right.
than you're in Florida. Have a wonderful
Right.
day.
Thanks a lot, Carrie. Stay
Bye.
well, stay healthy.
Thank you. You
And
too.
we'll be in touch. All
Okay.
right.
Take care.
Take care. Bye.